Hello everyone, welcome back to the channel. Today we are going to dive into a classical high-yield piece of neuropathology that beautifully bridges the gap between gross anatomy and modern neuroradiology. What we are looking at in the image is a coronal section of human brain. It is cut at the level of lateral ventricles, deep gray nuclei, and the temporal horns. The staining method used here is a classic Heidenhain myelin stain, which uses iron hematoxylin. Now here is the most crucial teaching point for this stain. Normal intact myelinated white matter stains dark blue or black. Gray matter structures and areas devoid of the myelin appear pale. When you look closely at this specimen, the large well demarcated pale zones embedded within the dark white matter are actually classic macroscopic multiple sclerosis plaques. Let's break down the exact anatomical localization of these lesions by following the arrows shown. First, look at the top arrow. These point to large prominent plaque immediately adjacent to the angle of lateral ventricles. This periventricular distribution is a hallmark of multiple sclerosis. Anatomically, these correspond directly to Dawson fingers we routinely see on sagittal T2 flare MRI sequences. They form here because the underlying inflammatory process is fundamentally venulocentric, tracking along the post-capillary medullary veins. Next, move down to the middle arrow on the left side of the image. The caption explicitly notes this is a plaque located right within the left internal capsule. Notice how sharp and well circumscribed the borders of the lesions are. Because the internal capsule is a dense highway for descending motor and ascending sensory tracts, a plaque in this specific tight real estate explains why some patient present with a sudden profound hemiparesis. This contrasts sharply with the plaques in large silent white matter zones that may remain completely asymptomatic. Finally, look at the bottom arrow. These demonstrate demyelinating plaque tracking along the white matter adjacent to the temporal horn of the lateral ventricles, extending near the hippocampal formation. So, let's see what makes this image valuable for clinical neurologist and is how perfectly it mirrors our modern imaging techniques. The punched out margin of these historical histological lesions are exact reasons why multiple sclerosis plaques appear so sharply demarcated on a 3 Tesla T2 weighted MRI today. Understanding the macroscopic pathology under a hidden stain reminds us that what we track on a screen every day in the clinic is a direct reflection of these physical perivenular focal myelin losses. Thank you for watching.